Hi, I'm Sara Schirripa. I'm a sophomore at Kent State University with a major in nursing. This is my fourth year in the internship program. This summer I had the honor of working in Hillcrest Hospital's NICU with my mentor Tina DiFiore, and the project that we worked on and are continuing to work on is regards the efficiency and accuracy of NeoTech NeoHold use under skin temperature probes. So to get started with a little background, thermal regulation is the equilibrium between heat loss and heat production. It's controlled by the nervous system, and it originates in our body's thermoreceptors, which send nerve impulses to the spinal cord and brain. This picture just explains what thermoregulation does. As you can see, if we have an increased body temperature, our hypothalamus tells the rest of our blood vessels to dilate. We begin to sweat and our body cools down. If we have a low body temperature, our hypothalamus tells our blood vessels to constrict and our muscles to begin shivering, to warm back up. There are several modes of heat production. They are voluntary muscle activity, which is physical movement, involuntary muscle activity, which is shivering, and non-shivering thermogenesis. Non-shivering thermogenesis requires the most calorie expenditure and the most energy, and that's the type of heat production that's seen most prominently in infants. There are several modes of heat loss. They are convective heat loss, radiant heat loss, evaporative heat loss, and conductive heat loss. And as you can see, there are many ways for an infant and an adult to lose body heat and only a few ways to gain it. So in Hillcrest Hospital's NICU, temperature regulation is a very important part of the survival of the patients. And what they do is they attach a temperature probe to the isolette, and then the other end is attached to the patient with a probe cover. And the isolette will adjust its temperature according to the baby's temperature. It's a safe and efficient way to monitor the baby's temperature and to see how well the baby is thermoregulating for him or herself. However, there is some complications with ulcerations and abrasions that can be caused by the temperature probe. The skin is the largest organ in the body, and it is very important. It serves many functions such as thermoregulation. It's a barrier for fluid and electrolyte loss. It prevents absorption of toxic substances. It's a conversion of bilirubin to an excretable form. It's an ultraviolet light protection. And in neonates, the skin is very fragile, so it's very important to protect its integrity. NeoTech NeoHold is a hydrocolloid dressing. It's designed specifically for neonatal skin. It's safe, it attaches for a long time, it produces excellent tracings, and it won't dry out. In Hillcrest Hospital's NICU, they use NeoTech NeoHold underneath skin temperature probes in order to prevent ulcerations and abrasions, as I mentioned before. So the purpose of our study was to compare the efficiency and the accuracy of NeoTech NeoHold when placed under skin temperature probes. And it was hypothesized that NeoTech NeoHold placement under skin temperature probes is both an efficient and an accurate way to measure neonatal skin temperature and also prevent skin breakdown. So for our methodology, we're looking to include infants that are born at 32 weeks gestation or less. These infants need constant thermoregulation and have many other complications. These infants that we would like to include in our study must have parental consent, both male and female patients, and they have to be less than 14 days of life. Our exclusions for our study would be infants born after 32 weeks gestation. These infants have a more stable temperature thermoregulation. Infants that are older than 14 days of life, or infants with a prior skin complication or ulceration were excluded from the study. So our research project aims at providing evidence that supports Hillcrest Hospital's NICU's current standard of care by placing a hydrocolloid dressing beneath temperature probes of infants with premature skin. And it also aims to create a standard of care for all hospitals that will both protect and safely monitor NICU infants' temperature and skin integrity. And eventually, we'd like to publish our findings in medical journals. So the data collection procedure that we are going to follow is we would first get informed consent from the parents of an infant eligible for our study. After informed consent is received, we will place 2 temperature probes on the infant. One probe will be directly adhered to the infant's skin, and the other will have Neotec NeoHold placed underneath. The temperature readings will follow Hillcrest Hospital's standard of care, which is temperatures recorded 4 times during the first hour following admission, and then every hour after that for the first 24 hours. After the first 24 hours, temperature is then recorded every 3 hours for 14 days. After 14 days, the infant's involvement in the study would be discontinued, and then our results would be compared and contrasted to determine the accuracy of hydrocolloid dressing placement underneath skin temperature probes. So the next steps are to first contact Neotec to determine whether the company has applied for an IDE and what their research contribution will be, to get IRB approval and involve a medical doctor in our study. Eventually we have to begin our data collection, then finish up our data collection and begin analysis, and then write up our research paper and publish our findings. And I would especially like to thank Kathy Mihalik for precepting me throughout the course of the internship program, my mentor Tina DiFiore, Marianne Yaver, Molly Looney, the entire staff of Hillcrest Hospital's NICU, and the Cleveland Clinic Office of Civic Education Initiatives. Thank you.